Hey, it's Dr. Allin here at Chiropractor Woodstock. I got Dr. Shelby here. We're going to show you how to use a massage gun while somebody's laying down. We're going to be focusing on the lower back and hip region. So I'll have her lie face down here. Now when somebody's laying on their stomach, especially at home, if you're on a softer surface like a bed or a couch or anything like that, it might be uncomfortable on the lower back. So something that you may want to try is placing a bolster under their hips. So I'm going to have you go ahead and kind of rest up on your elbows and your hips for a second. Slide that underneath. Now it doesn't have to be a round bolster. You could also just use a pillow, but that will greatly take a lot of pressure off of the lower back if this is uncomfortable laying in this position. Now the muscles we're going to be focusing on today are going to be the lats, the deep muscles in the lower back known as your quadratus lumborum, your multifidi muscles, and then your hip rotators in the gluteal region. So when we look at the massage gun, we're going to start with a large ball, just like this guy here. We want a large surface area. We're going to scan the area that we're working on, and then we're going to swap out this head for a smaller surface area to work on the more focused points. So just as a quick overview of what we're going to be working on, the latissimus muscles are one of the largest muscles in the body. They cover most of the lower and middle back region, and they insert into what's known as the thoracolumbar fascia, which is a dense connective tissue down in the lower back. So when low backs get really stiff and tight, this is a really good muscle to start to work on. So when we start scanning this muscle, we're going to start up in the armpit region here, and we're going to bring down and towards the hip. So when I'm scanning, I'm going to turn this to a relatively high setting. Then going to start working just down and towards the hip. Now what you have to watch out for is the hip bone, known as the iliac crest. It's kind of like a curved shaped bone right around through here. When we're doing massage gun, you don't want to go over bony prominences too much because it doesn't feel very good. So I'm just going to scan up and down. And again, it's kind of like a shape that kind of pinches up into the front, so more narrow up by the shoulder. And it gets broad as it comes down into the lower back. So I'm kind of outlining the iliac crest, coming up along the back and over in towards the arm. And make sure we do both sides here. Now as far as pressure is concerned, when you're using the massage gun, you don't want to be applying a lot of pressure. You just let the massage gun do the work. Doing okay with that pressure, Doc? We're doing good. Doing good. All right, now I've got that superficial tissue kind of warmed up here. We're going to move into a deeper structure known as the quadratus lumborum muscle. So for that muscle, I'll show you really quick. We're going to move into the deeper structures. So real quick, we'll pull these muscles away. We're getting into the deep structures of the lower back. So with quadratus lumborum, it connects your lower rib cage onto your pelvis. This is a very common area that's super sore on a lot of people with low back pain. For this one, we're going to use a smaller surface area tool. I'm going to start to turn this up here. Now when we're doing a smaller surface area, we want to have a lower setting. So not super high speed, so like a medium to medium low. Now what I'm going to look for is the lower ribs and then the pelvis. And when I find those two structures, I'm going to come in about a 45-degree angle. Now the spine is going to be right here. So I'm maybe like 2 or 3 fingers out from the spine, and I'm coming in at about a 45-degree angle. So when I place my tool, I'm going to sink in gently. And we're going to hold this position here for about 30 seconds and have them take some nice deep breaths while we're holding it. How are we doing with that pressure? Now again, I'm not pushing the tool into the individual here. We're slowly just letting it sink in and letting the machine do the work. Good. Now, as I come over, I can just go a little bit over this way and I'm going to be on the multifidi muscle. And this one is a larger muscle in the lower back, larger than the quadratus lumborum muscle, and it's very commonly sore. So I'm doing a little bit of scanning, and I'm going to find that tender point. So tender points usually feel like an increased density. They'll feel kind of like a lump. As you use these massage guns, you'll be able to feel with them a little bit more, where that kind of catches, it gets a little harder to glide over the surface. And that's usually where those tender points are. A little tender right in that spot.
Oh yeah.
Again, we're just gonna hold there for about 30 seconds, have them take some nice deep breaths. Very good. Good, now we're gonna move on to the other side. Again, we're gonna find the lower rib cage, find the pelvis. We're gonna go right between those 2 points, about 3 fingers off the spine, and be going in about 45 degrees in. You're gonna hold this point for about 30 seconds. It's okay to move a little bit, you just don't wanna do a lot of movement up and down. It's a pretty sensitive area, so you gotta be very careful with how much pressure you're putting into this spot. It's always good to check in. How's the pressure doing there? Perfect. Good. Now I'm going to slide over a couple fingers. Now again, watch out for the spine. Do not go on the bony prominence here. Prominence there. It does not feel good, and they might jump off the table a little bit. All right, I'm going to scan this one up and down a little bit. Tender point right about there. Again, I'm just trying to find an increased density in the tissue. Good. So now we've worked through the lats, the quadratus lumborum, the multifidi muscles. We're going to go into the hip rotators. Now when we're working on the hip rotator muscles, we're going to be working primarily on gluteus medius and piriformis. So these are the deeper muscles in the hip. Gluteus medius is a little bit larger. And when we look at it on the body, it's basically going to cover this portion of the pelvis. So this is that iliac crest we were talking about. So you're going to try to find that. We're just going to dive right in through there. We're going to work from that iliac crest down towards the femur bone. So this is called your greater trochanter, and you can feel that right on the side of your hip there. So this muscle is going to span all the way through here, kind of like a fan shape. Now the piriformis muscle, a little bit different. That's more like a hip rotator. So the piriformis muscle is going to run from the greater trochanter onto the sacrum. So it kind of goes like this way. So when we're looking for that one, we're going to find the greater trochanter. We're going to find part of the pelvis there. We're going to try to go right between those 2 points. So I'm going to start with the larger, the ball, just to get the tissue warmed up. So right now what I'm looking for is her pelvis, the iliac crest here, and the greater trochanter is going to be right on the side. So between those 2 points, we're going to use the massage gun. We're going to angle it in about a 45-degree angle. We're just going to work up and down into that glute med muscle. Now this one can be pretty sore, especially Dr. Shelby just had a nice leg workout the other day, so she's feeling it, I'm sure, right about now. So I'm just scanning this tissue, and again, it's like a fan shape, so it gets a little more broad as you get up into the top. Good. We're going to work through the other side. So generally speaking, you don't want to stay on one point for a whole lot of time, maybe a couple minutes. For demonstration purposes, I'm moving kind of quick, but you can spend a few minutes on one point. Yeah, I see her leg's starting to twitch a little bit as I get onto this point here. So that means she's got a pretty gnarly trigger point, most likely in that rotator piriformis muscle here. So we're just gonna get this warmed up a little more. So when you do see a twitch response like that, it's not necessarily a bad thing, just means we need to back off a little bit, but that indicates there is a trigger point and a tissue that needs to be worked. All right, we're gonna swap out the head here for the smaller head. Now for this one, we're gonna find her sacrum, and then we're gonna find her greater trochanter. So between sacrum, greater trochanter, we're gonna bisect that line right into the middle, and that's where our piriformis muscle is gonna be. Now this one, you don't wanna go too crazy on, just let the machine rest. And we're gonna hang there for a little bit. Again, we're getting a little twitch response on this, so this muscle's been worked out. It's got some trigger point formations in there, and this is gonna help break up those trigger points, bring some blood flow into the muscle, and help it start functioning a little bit better. So we'll do about 30 seconds on this side. Just be careful again, you're not going over bone. When you hit bone, the machine's gonna start to vibrate. It's gonna make a loud noise, kind of like that. It does not feel very good. We're gonna come to the other side. Again, I'm finding her sacrum, which is that lower triangle bone on the end of the spine. We're gonna find that greater trochanter and we're gonna bisect that line. I'm gonna start to sink in. Now, if I start to see that twitch response, I'm gonna back off a little bit. Go ahead and take a couple nice deep breaths here. Good. Another thing you can do when you're on the tissue, if the hip rotators are super tight, we can bend the leg like this, and we can start to rotate in and out just like this. This is gonna add some internal tension on the muscle and helps it release a little bit better, especially if they're super tight. You okay there? All right. All right, we'll come off nice and easy. All right. So that's going through the low back and hip region with the massage gun. Again, you don't have to put a lot of pressure with these things. Let the massage gun do the work and make sure that they're focusing on their breath and make sure you're checking with pressure as you go. So be safe with these, have fun, get at it. See you soon.